So using nicotine replacement therapy is very, very important to get the technique right. One of the examples of a product is something like a patch. Very important when you're initially using a patch, you take the backing off, like this. You find a hairless part of the skin to stick the patch down on, for example the arm, top part of the arm, or maybe even around the shoulder, to the least sensitive parts of the skin. You stick the patch down and you use, for example, the palm of your hand to actually keep it down. You may find initially you can get a bit of redness of the skin, that's quite normal. But of course, if it's becoming like inflamed or anything like that, then of course the patch may not be suitable for you. But most people do get a little bit of skin irritation, and that's absolutely normal. It should settle down. Each day you change the location you stick the patch. Before bedtime, some people like to take their patch off, especially if they don't get up in the middle of the night to smoke. And in pregnancy, it's important to take the patch off, important there. The other thing I would say is think about the strength, because the strength, if you go for the high strength, if a person smokes, say, for example, first thing in the morning and they smoke maybe more than 10 a day, it's really important to go for the high strength patch. And you stay on that high strength patch for as long as you need to. You get advice from your GP or your pharmacist or your nurse, for example, or the stop smoking advisor. They will give you some good top tips. But you can get also lots of information on the, for example, the Stop Smoking London website about their medication as well. So patch is very, very good. Just be watchful of not underdosing, because if you underdose, one of the biggest things you'll find is your cravings will be very high and you may end up going back to smoking. You tend to get far less nicotine from these products than you would from your cigarettes or roll-ups. So don't worry about overdosing.